Okay, everybody, we are on the last article in this issue of JAVMA, June 1st, 2015. Community rabies knowledge and pet vaccination practices after a skunk rabies outbreak in Eddy County, New Mexico. This study comes out of multiple locations. The Epidemic Intelligence Service, Public Health Associate Program, Poxvirus and Rabies Branch, City of Carlsbad Animal Control, Carlsbad Animal Clinic, Animal Care Center, Desert Willow Veterinary Services, Noah's Ark Animal Shelter, Eddy County Agriculture Extension Agent, Department of Health, Animal Ophthalmology Clinic, Department of Anthropology at the University of Georgia. The objective: to determine percentages of domestic cats and dogs vaccinated against rabies, identify barriers to vaccination, and assess knowledge about rabies in a semi-rural New Mexico community after a skunk rabies outbreak. The sample was 366 residential properties in Eddy County, New Mexico. Results found that 73% of households owned a dog or a cat. Cats were more likely than dogs to not have up-to-date rabies. Cost and time or scheduling were the most frequent barriers to vaccination. 65% did not know livestock can transmit rabies. 32% did not know rabies is fatal. 36% did not know a bat scratching a person is exposure. 76% said they would contact animal control if they saw a sick skunk. 67% said they would contact animal control if bitten by a dog they did not know or they did not own. Conclusions: rabies vaccination prevalence among pet dogs and cats was low. Substantial percentages of respondents did not have correct knowledge of rabies or rabies exposure. And that's pretty typical. I don't think it's unique to this area. I think most people in general just don't know about rabies. In 2011 and 2012, Eddy County, New Mexico experienced a skunk rabies outbreak. 41 skunks, 1 horse, 2 raccoons, 4 fox, 3 bats, 2 dogs were tested positive. In contrast to the 41 rabid skunks identified during the 2011 and 2012, only 28 skunks from Eddy County tested positive during the entire 45-year period prior to this outbreak. Most of the animals were tested because of potential human or domestic pet exposure, and in this region, wild animals were tested only in response to exposure but not as routine surveillance. Most of the rabid skunks identified during the outbreak had been killed by or fought with family-owned pets in or around household yards. During this year's, at least 85 cats and 49 dogs were euthanized due to exposure. They were not up to date on rabies vaccines, and owners didn't want to do a 6-month quarantine. Also during the outbreak, 29 county residents received post-exposure prophylaxis. This costed over $100,000, estimated by the New Mexico Department of Health. Animal control calls increased substantially during the outbreak, with the 3 animal control officers for the city of Carlsbad, New Mexico, responding to approximately 400 to 500 calls each month during the outbreak. Under state law in New Mexico, dogs and cats are required to be vaccinated against rabies at 12 weeks of age, then 1 year after vaccination, then every 3 years. Carlsbad requires dogs and cats to be licensed annually, granting licenses only to pet owners with certification of current rabies vaccination. Eddy County does not require dogs and cats to be licensed, but requires owners to keep copies of rabies vaccination certificates for the dogs and cats and to affix a rabies tag to their pet when they leave the household or the property. See, right away there's a problem, right? Lack of consistency. Why not even this is within one state between 2 different cities, they have different rules. It's so crazy. The entire US should standardize how they do this. A 2009 mailed survey of pet owners in Flagstaff, Arizona found 96% of dogs, 90% of outdoor cats, and 76% of indoor cats had been vaccinated. A Brazos County in, I think, Texas telephone survey conducted during the same year found dogs aged 4 to 15 months were less likely to be vaccinated against rabies. That study also found an increase in vaccination prevalence after the state implemented a 3-year rabies vaccine policy. An Arizona study found that 97% of both pet owners and individuals who did not own pets knew that rabies was transmitted through bites. 74% knew it was transmitted through contact with saliva. 73% knew it was transmitted through scratches. However, fewer people said they would seek medical attention if bit by a domestic animal. than if they were bit by a wild animal. Most also reported that they would contact animal control or other agencies if bitten or scratched. A study in Texas found that 86% of respondents would report being bit by a dog they did not know. Women, persons living within city limits, and people over 65 years of age were more likely to report a dog bite. Dog ownership, however, did not change the percentage of persons reporting a bite. In the Arizona survey of both dog owners and individuals who did not own pets, 59% knew rabies can lead to death without treatment. Materials and methods. At the time of this study, Eddy County was 90% rangeland and had a population of 54,419, or 5 people per kilometer squared. However, most residents, 26,296 people, or 356.2 persons per kilometer squared, live in the city of Carlsbad. 366 residential properties were randomly selected from the 11,976 residential addresses within the Carlsbad Soil and Water Conservation District, the area in Eddy County where the 2011 to 2012 rabies outbreak had occurred. Okay, results. Let's see. 86% of people completed the survey. 56% were women. Median age 50 years. 74% lived in Carlsbad. 68% did not have a college degree. 58% were non-Hispanic white. 73% were pet owners. 76% were households where nobody answered the door. Regarding vaccination prevalence and barriers to vaccines, 29% reported that not all pets had up-to-date rabies vaccination. Pet-owning respondents without a college degree, which is 66%, were more likely, significantly more likely, to have pets without up-to-date rabies vaccination, compared with pet owners with a college degree or higher at 34%. A higher percentage of households with dogs as pets, 83%, had up-to-date vaccine status compared with households with cats for pets at 45%, and those houses with both dogs and cats at 48%. Only 43% of households leaving food outside overnight for their own pets, and 36% leaving food outside for strays or wildlife, reported that all their pets had up-to-date rabies vaccine. 29% were reported to not have an up-to-date vaccine status. Cats, making up 45%, were significantly more likely than dogs at 14% to not have up-to-date vaccine. Vaccine prevalence was not significantly different between urban, meaning within the city of Carlsbad, and rural, meaning within unincorporated portions of the county of the pets. Pets allowed to roam freely were more likely to not have up-to-date vaccines. Pets housed primarily outside were more likely not to be vaccinated. Sexually intact, not vaccinated. Respondents most frequently identified cost at 33% and time or scheduling at 21% as barriers. 14% did not believe that any barriers were encountered. I mean, these are all common sense stuff, right? Like you would kind of assume if you were asked to guess between two different options of who's more likely not to vaccinate in what scenario, these are pretty much what you'd expect. Knowledge of and attitudes about rabies, rabies vaccines, and wild animal exposure. 90% correctly identified raccoons, skunks, cats, dogs, coyotes, foxes as being transmissible. However, 65% did not know that horses and cattle can also transmit. 92% knew that unvaccinated pets can contract rabies. 32% did not know that rabies vaccination was required by law. 36% did not know a bat scratching a person can be exposure. 18% did not know a dog playing with a bat can be exposure. 43% did not correctly identify both of these as exposures. 32% did not know rabies was fatal. 68% had heard about the outbreak from one or more sources. News was 59%. Television 22%. Family or friends 18%. Respondents identified veterinarians at 85% as most trusted, followed by animal control officers at 57%, public health officials 50%, TV 49%, newspaper 48%, radio 37%, internet 37%. Pet owners at 52% were less likely, significantly less likely than those not owning pets at 69%, to list animal control officers as a most trusted source. Fewer than half of them, 44%, did not. 44% of pet owners, but most non-pet owners is 70%, stated that the top reason for vaccinating was because people might get rabies. A significantly higher percentage of pet owners, at 39%, than non-pet owners at 15%, answered that the top reason was concern that a dog might get rabies. The primary reason given by other respondents for vaccinating include legal requirements at 10% for pet owners and 13% for non-pet owners, as well as veterinarian recommendations at 3% of pet owners. Respondents were allowed only one answer when asked how they might respond to finding a sick bat or sick skunk. Most said animal control, 76% for a sick skunk, 69% for a sick bat, or to kill the animal at 19% for a skunk, 90% for a bat. Discussion. In this study, 75% of pet dogs and cats had a current rabies vaccination status, meaning had received a rabies vaccine within the past 3 years, and all pets had a current rabies vaccination status in only 71% of pet-owning households. This was well below the post-outbreak rabies vaccination prevalence of 90% in Flagstaff, Arizona. Several factors, meaning pet species like cat versus dog, or allowing pets to roam freely, or housing pet outside, or not having pets spayed or neutered, were associated with lower rabies vaccination, and households that left food outside overnight for their pets or strays or wildlife were more likely to have one or more pets that were not up to date on vaccines. Similar findings in another study, 68% of respondents in the present study knew that rabies was fatal. In New Mexico, potential rabies exposures are addressed when animal control is contacted by an exposed person, a medical provider caring for an exposed person, or a veterinarian caring for an exposed pet. To increase rabies vaccine prevalence, community stakeholder partners subsequently implemented measures to improve rabies vaccination rates in the community. Small animal practices required that dogs and cats have rabies vaccine before any procedures were performed. Local animal shelter provided free rabies vaccination vouchers for adopted dogs and cats that can be redeemed at local veterinary clinics after adoption. Stakeholders agreed to develop an annual multi-agency outreach campaign highlighting the importance of vaccination at 12 weeks, at 1 year of age, and at 3 years. And the 3 veterinary clinics agreed to collaborate on an annual vaccination clinic for the community. To address knowledge gaps, stakeholders began conducting outreach through their own agencies and education programs in local schools. They also started training animal control and wildlife field personnel, annual rabies awareness month, billboards, stickers on dog foods in stores, and social media. So yeah, I mean it's a good overview on how much we don't know regarding rabies as far as the general community goes, which is unfortunate. But you can blame that on everything. Everything these days is poor education, it seems, unfortunately. But in the grand scheme of things, rabies is not that common of a problem. It just isn't. We only care about it when there's an outbreak or when you're personally affected by it, and then it's hindsight. So for veterinarians, stressing the importance of up-to-date rabies vaccination and being active in your community, try and help education is important. And then for pet owners, get your animals vaccinated. Out of all the vaccinations, well, it depends, I guess. For dogs, rabies and parvovirus are probably the 2 most important ones, I would say. I mean, again, people are going to argue with that because there's outbreaks of influenza that happen in dogs, and if you're in a Lyme area, maybe Lyme vaccine is important for you, so it kind of depends. And then for cats, definitely rabies is the most important one. The other ones are kind of depends on your animal's lifestyle. The vaccination conversation is a whole other topic. We do tend to over-vaccinate our animals, and we don't really tailor it to what the animal's life is going to be. But that's another discussion for another time. All right, guys, that's the end of this journal. We will change over to another journal starting tomorrow. Take care.